Today I came across this question online, and that is there a penalty to switch from a Medicare Advantage plan back to original Medicare? So we're going to talk about that. And today, if you're one of those people, maybe because the Medicare open enrollment is almost here and you're thinking about switching from your Medicare Advantage plan back to original Medicare, I'm going to try to cover quite a bit in this video. If I miss something, though, you can always reach out to me. My toll-free number is there at the bottom of the page, or leave me a comment below. So Medicare open enrollment starts this month, and there are a lot of people who are now thinking about their Medicare coverage, maybe for the first time this year. There's a lot of marketing that happens around this time of the year. So Medicare really does start to become top of mind for a lot of people right around October. There's a lot of people who have Medicare Advantage plans who maybe have gotten an annual notice of change, and they've found out that their coverage is going to change in some way in the coming year. Or maybe they had a Medicare Advantage plan this last year and it didn't work for them for a number of reasons, including network restrictions or prior authorization. Here's what you need to know. You can switch from Medicare Advantage back to original Medicare during the Medicare open enrollment without penalty. But there are several things that you need to consider before you do this. The very first thing you need to consider is, are you going to be able to qualify for a Medicare supplement plan? Because if you just switch from Medicare Advantage and go to original Medicare and you don't have a Medigap plan in place, you're going to have 20% out-of-pocket exposure, because original Medicare covers 80% of your medically necessary services, which means that you're responsible for the 20% out of pocket, and there is no cap on that 20%. So if maybe you know somebody who only has traditional Medicare, they don't have a supplement, they don't have an advantage, a lot of them don't realize that they have a 20% out of pocket exposure, which isn't a big deal until it is. You get cancer, you have a heart attack or stroke, or you end up in the hospital. So these are some of the things that you're going to want to consider if you're thinking about switching from a Medicare Advantage back to original Medicare. Now, there are some people who signed up for a Medicare Advantage plan for the very first time, and they will qualify for the Medicare Advantage trial period. Basically, what that means is if they qualify for this, they can get a Medicare supplement plan still without medical underwriting. There could be other situations of people who are relatively new to Medicare. In other words, they got a Medicare Advantage and they're still in their Medigap open enrollment period. The Medigap open enrollment period runs for 6 months, typically from the month you start Medicare, or usually the month you turn 65. So you could have a unique situation like that. You could be in really good health. Maybe you signed up for a Medicare Advantage plan because you didn't know what it was, and you found out that your doctor or your specialist or your hospital wasn't in network, and now you're thinking, wow, I need to get back on original Medicare so that I can use the doctor's specialist, provider, what have you, that I want to use. So there's a lot of factors to consider when you're thinking about moving from from Medicare Advantage back to original Medicare. Another couple things to consider is, if you move from Medicare Advantage, there's probably Medicare prescription drug coverage with that Medicare Advantage plan. So if you move over from Medicare Advantage to original Medicare, you lose your Medicare prescription drug coverage. So you would also want to consider a Part D prescription drug plan for the new year as well. Again, I can't emphasize this enough. You have to be cautious about just moving to traditional Medicare without knowing if you'll qualify for that Medicare supplement. Because usually, even with a Medicare Advantage, you have a financial stop at that maximum out of pocket. So let's say you have a maximum out of pocket of $3,000. So you're paying your monthly premium for that Medicare Advantage, but the max you're going to pay out of pocket is $3,000. Some of the other things you could consider doing is just shopping Medicare Advantage plans. There could be a better Medicare Advantage plan available for you in your area than the one you had previously. So the Medicare open enrollment period is a great time to explore all of your options, work with a trusted licensed insurance agent or your local SHIP department in your state that has Medicare advisors. Don't go it alone. There are many, many people out there that are willing to help you. That's what they're there for. They're experts in their area, and they can ensure that you don't make a mistake that you regret later. So again, if you have questions about this, you can reach out to me, toll free 1-800-974-0552. You can also connect with me through my website at meetjamie.com. If you enjoy videos like this, please subscribe to my channel, hit the like button, and if you have questions, general questions about Medicare, leave them in the comments below. Thanks so much for watching. We'll see you in the next one. Have a great day.